and welcome to our special show, Coronavirus Facts versus Myths. I'm Gargi Rawat. This is the show where we get you all the latest on the pandemic. We'll also have doctors answering your questions on coronavirus. Any doubts that you may have, do call us on that number on your screen. Let's take a look at the headlines. We're tracking India records 4,14,188 new COVID cases in 24 hours. That's the highest so far. India also registers 3,915 COVID-related deaths. The pandemic moves south. Major surge in cases reported in southern states. A crisis of lack of hospital beds and oxygen supply there as well. Now, as India's COVID cases continue to rise, with over 4 lakh cases being reported for the second day, oxygen therapy has emerged as a primary treatment for the critical patients. However, as India battles a massive spike of cases and health infrastructure is crumbling, people have been forced to look for alternatives. And so the demand for oxygen concentrators has risen exponentially in the last couple of weeks. There are orders being placed abroad. Supplies are running short in the country. In fact, the Delhi police recently busted a racket involving black marketing of oxygen concentrators from a South Delhi restaurant. And in fact, some of the machines that were being sold by them were not even appropriate for COVID patients. Well, to talk more about what you need to look out for and when does one even need an oxygen concentrator, we're joined by Dr. Gautam Sehgal, CEO of Vedmed Healthcare, someone who's been dealing with oxygen concentrators for several years now. Thank you so much, Doctor, for joining us. First and foremost, I think everybody wants to know, as there's this desperate search for oxygen concentrators, what does one look out for?
They basically look out for one thing only. They look out at the oxygen purity given by the concentrator should be 90% and above overall flow. So what I mean by that is if you're giving 1 liter, 2 liter, 3 liter, 4 liter, 5 liter, up to 10 liters, it should be 90% and above. That is the critical point you need to keep in mind when you buy one. Got it?
Because there are many different types of oxygen concentrators, and many of them one doesn't even realize right now, but many of them are not even appropriate for COVID patients.
Yes, the concentrator technology came in 20 years ago, and there are a lot of concentrators being sold. But as long as you don't buy a concentrator with a variable flow, what I mean by that is that the flow of oxygen and the purity of oxygen does not fall below 90%. And those machines should be fine. The various models which are available, companies which sell them, the only difference is how long will this machine run for before you give it a rest. Like any machine, it needs to be switched off.
All right, so you have to look for how long it will run. Also, maintenance of the machine?
These are pretty much maintenance-free machines. When you buy the machine, you make sure you get a humidifier bottle, 2 nasal cannulas, and you're good to go. 3,000 hours is what you need. You can run the machine before the sieve is changed. The sieve is basically a part which takes out the nitrogen and gives you oxygen, to put it very, very simply. So that's it. And you get a filter which needs to be changed after 1,000 hours. So not much maintenance to do if you get the right machine.
Right, and we believe the sizes are you get a 10-liter oxygen concentrator or 5-liter one. Which one is the one that you should go for?
You need to really, when you get mild to moderate COVID, you need to talk to your physician, how much oxygen do I need? Mild COVID patients are doing well with 5-liter concentrators. Mild to moderate patients whose oxygen falls dramatically need 10 liters. So now what we are seeing is everybody wants a 10-liter. And when these 10 liters aren't available, there is panic. There are devices available where you can take 2 5-liters, connect them, and give you 8 to 9 liters of oxygen. But do understand, Gargi, if a patient needs 8 to 9 liters of oxygen at home, that is the time you should be looking for a hospital bed.
Right. In fact, that's the next thing I wanted to ask you is when does one go in for an oxygen concentrator and when does one know when to escalate the matters and, look for a hospital bed?
What we are seeing basically is people who get, everybody has a pulse oximeter at home. You've seen that small gadget which you put on your finger, which gives you the concentration of oxygen in your blood. So what we recommend and what tell patients to do is please do the oxygen concentration on your pulse oximeter every day. That will give you a baseline level. Now, if you get COVID please do it every 4 hours. And if you see if you see your saturation falling, then you need to look for a concentrator, have a concentrator, or have a cylinder. But a lot of people already are buying them for emergencies. You drop between 91 to 92%. On the advice of your doctor, you start taking oxygen. Either you start with 1 to 2 liters a day, and then you ramp it up. But once you start dropping even more seriously, you come down to 84, 85, 86. These concentrators will maintain your oxygen only to a certain level. But you need to go into a hospital bed. But what we're also telling patients to do is to have a concentrator and, if possible, borrow a cylinder. Because we will shut the concentrator off after so many hours. After that, you will need to get onto the cylinder.
In fact, I was also going to ask you, how does it compare an oxygen concentrator and getting an oxygen cylinder?
An oxygen cylinder comes in various sizes, 6 liters, 9 liters, 15 liters, the D-grade cylinders for hospitals, which are 45 liters. The advantage of an oxygen cylinder is it has 99.67% or more pure oxygen. The disadvantage is that it gets over. Whereas a concentrator will only give you the max 93%. A few really good ones give you 95%. So you need to also keep that in mind when you move from a cylinder to a concentrator and a concentrator to a cylinder, vice versa. If you go from a concentrator to a cylinder, you bring the oxygen down. And if you go the other way, you increase the number of liters of oxygen you get.
Right.
And there is, as you... Sorry, go ahead.
No, I was also going to ask something that I've seen people say is that you need a well-ventilated room for an oxygen concentrator, that you can't keep the room closed. How true is that?
Yes. In the past 4 days, there have been a lot of social media posts that nitrogen in the room, excess nitrogen. This device has been there for about 18, 19 years, and there is no clinical study which is done to see whether a closed room causes harm. But, you know, in today's COVID times where the patients are already very, very nervous, open a window is easy to do. They can go ahead, but it's not something, there are no clinical studies.
All right. And as you said, there's a shortage in the market of the 10-liter oxygen concentrators. What should one do if they can only access the 5-liter ones?
What's happening is friends and family have concentrators. They all have a few, and they are expensive. Let's say you need more than 5 liters, you borrow it. There is a device available, which is a few hundred rupees, where you can connect 2 machines together and give 8 or 9 liters of oxygen. It costs maybe 700-800 rupees. It's just a Y connector, which is connecting 2 machines to your cannula. Those are pretty easily available. Look for those. And that way you don't only want a 10 liter when you don't really need one. That's one way to look at it.
And there's a device called a splitter. We'll just show those visuals again of the oxygen concentrators, and you can actually use it on one concentrator to give, 5 separate patients.
Yeah, a splitter is something which has been in the market it's been available. I don't know if they're still available. As you can see, you connect your 10-liter machine to this and then decide you can have 5 patients being used at the same time.
Right, this is something which would be helpful in hospitals at least. And doctor, right now there's such a desperate search for these oxygen concentrators. We know that a lot of aid is coming in from abroad where they're being got, but a lot of people are also trying to, organize it privately. A lot of orders have been given in China, I believe in Singapore as well, Dubai as well, and in the United States as well. People are ordering them. So it's a lot of panic and I have to say a fair amount of confusion as well.
Let's go to different countries. America. There are a lot of NRIs there who are sending concentrators to the family members. In India, the government has waived the duty. So those work in India, but you only need a step-down transformer. Look at the wattage of the machine, double the load, and you just put a 2 kVA step-down, it works fine. Now let's look at machines in Dubai, Istanbul, Israel, Singapore. Those are pretty good machines because in certain countries like Taiwan, these are grade 2 medical devices. So if you buy from a medical store, you will get a good machine. China, yes, is the major supplier of concentrators, has been for many years. But do understand, some of the Chinese companies have US FDA certification. So if you get those work really well. So when you buy a Chinese machine, look at one of the things to look at, which works, is the weight of the machine. If the heavier the machine, the heavier the compressor. The heavier the compressor, I think, the more the machine works. If you have 90% oxygen purity, you have a really heavy machine, 20 to 25 kilograms, which is 10 liters. It should work fine. Happy.
All right. Well, thank you so much, Dr. Gautam Sehgal, for speaking to us. And clearly, when you are on that search for an oxygen concentrator, there are certain things that you have to look out for and be careful and ensure that the one you buy is appropriate for the patient in your home. Thank you so much, Doctor, for joining us.
Thank you. Thank you, Gautam. Take care.
Well, we're now going to talk about breakthrough infections. What are breakthrough infections? This is when people get coronavirus after they've got vaccinated by either one or both shots of the vaccine. Experts say while this is happening and it has been reported here in India as well, it does not mean that the vaccine is not working. In fact, the ICMR is currently doing a study on this, on breakthrough infections. And according to reports so far in the initial stages, they found that the vaccines help reducing the risk of hospitalization significantly. Well, to talk more about this, we're joined by Dr. Rachna Kucheria, epidemiologist, and Dr. Sameer Gupta, cardiologist, director, Metro Group of Hospital. Thank you so much, doctors, for joining us. Dr. Kucheria, first to you, there have been several reports of breakthrough cases, and you know, it gets discussed on social media, and people get a little worried about this.
Hi, thank you for having me. And I would correct the terminology first. I mean, I don't think we should say breakthrough cases. I think what you're trying to say, or maybe people have raised questions with, is that they got the vaccine and then they still got the COVID infection. Well, a couple of things could be happening. One, and I've had that in many patients as well, that very soon after the vaccination, they've reported actual COVID and it's RT-PCR positive. So couple of possibilities. One, with the high prevalence rates in the community anyway, they could well be incubating the virus while they went on to get the vaccine. That's one possibility. The other is that, while they were waiting the half an hour or what have you to go, be in the center and masks were not proper, they could have got infected by other people who are asymptomatic or in early stages of the disease. So yes, infections are happening in people who've had the vaccine, even one dose or two, but mostly they are not reaching the hospital and they are not severe. I also look forward to the Indian data. We have data from the UK already that after their second wave, they've collected a large number of data that, those who did have the vaccine, the hospitalizations were almost nil. So the vaccine endpoint, I've said this before, was never to prevent infection. The vaccine endpoints are to prevent severe disease and hospitalization. And while we look at our own data, I think the clinical experience for most of us has been that that part is happening.
All right. Dr. Gupta, what has your experience been among patients? And also what happens if people are asymptomatic, as Dr. Kucheria said, and this could, of course, given that, the high extent of the spread of coronavirus in our community, that a lot of people who are asymptomatic are going ahead and getting the vaccine.
I would like to echo what Dr. Kucheria said regarding the infection. We are seeing, I personally know of at least more than 20 people who have gotten COVID after either the first or second dose, a lot of them after the second dose too. And like she said, either they were harboring the infection before they got the vaccination, or they picked up the vaccine, they picked up the infection at the time of vaccination. They went to a community setting where there were a lot of people, and they picked up the infection. But we do know, and what we are seeing is that that people who are getting COVID after the infection usually are getting it a mild to moderate and not a very, very severe infection which requires ICU level of care. And that is what the goal of the vaccination is, right? I mean, we give vaccine not just to prevent infection, we also give it to reduce the severity of the infection if the infection is to happen. And in none of these people whom I know or whom I've treated or seen who have gotten COVID after both doses or a single dose of vaccination are people who have gotten acutely sick, requiring BiPAP or ventilator. They have gotten mild to moderate COVID and have recovered. So that is, I think the vaccination is doing its job in reducing the severity of infection compared to those people who don't have any immunity at all whatsoever. So I think vaccination is the right thing to do, and it is important that we as a country ramp up our immunization process and vaccination process, because that is one of the only ways we will be able to fight the infection and end the pandemic.
Right. Dr. Kucheria, also, one of the doctors I'd spoken to earlier pointed out how people need to know that the vaccine is not a cure if they have COVID. What's happening, he was saying, and he's heard reports, is that people, are mildly sick and they think, oh, let me just quickly go and get vaccinated. And they, again, as you said, are probably harboring, the infection, and they go ahead and get vaccinated because they think that somehow it's going to protect them from getting ill.
Wow. I must admit that this is the first I've heard of it, but you obviously get to hear so many more things.
This was from Bengaluru. This was a doctor from Bengaluru who said this.
And absolutely not. I mean, if you have mild symptoms, this is what we're saying at this point. If you have mild symptoms, a cough, fever, just body aches, even just an unknown tiredness, please consider this COVID, isolate and do nothing more. You can go ahead and get a test, and that I know right now practically is very difficult in most cities for somebody to come and do a home collection, and the reports may take 3 or 4 days. Please don't step outside your room even and go around infecting other people. At this time, this cluster of symptoms is COVID until proved otherwise. So, cut the transmission, help us. And unfortunately, I'm still seeing patients where they've had these symptoms for 7-8 days and they're not isolating. So this message really needs to be clear. Fever, cough, body ache, headache, just a little bit of dryness here in the throat. Isolate, wait it out, consult somebody, wait for a test, but don't go ahead infecting. It's a small inconvenience to isolate yourself versus going ahead and infecting the rest of your family or community outside.
Right, absolutely. And, as you were saying, we need a definitive study on this. Dr. Gupta, it would be great to see, maybe a few months down the line, how many of such breakthrough infections, as they're called, are really reported, and how many of them actually need a hospitalization or lead to a serious illness.
Yeah, I think this is data that we are all looking forward to seeing. I know there's been a lot of speculation about one vaccination over the other, about new strains coming out,
yes,
about seeing if the serum from those people who are immunized versus one of the variants, the second variant, and the data so far has been fairly promising. Where in some of these vaccinations, whether it's the Pfizer vaccine or the Covaxin, there has been negation of the virus of different strains. But this is data that we're all looking very closely at because as the pandemic evolves, we will see new strains coming up. Some of these strains may be mild and some of them may be more. So I think we're all looking forward to this data, trying to see how we can end this and fight this together.
Right, especially as we have more variants also being reported and, the gathering speed across the country. Well, with that, we'll slip into a short break, but return with our viewer question segment. So do call in on that number on your screens if you have any questions for the doctors. Stay with us. Welcome back. You're watching our special show, Coronavirus Facts versus Myths, and we have doctors with us to answer all questions that you may have. And let's just get our first caller, Vishnu from Thanjavur, from Tamil Nadu, calling in. Go ahead with your question.
Yeah, good afternoon, ma'am. I have this question regarding this coronavirus vaccine. How long we can delay the second dose of vaccine? Can we do like after 6 months or 8 months? So what is the most extended time? I need to know that.
All right, Dr. Kucheria, to you.
Yes. So with Covaxin, the guideline is 1 month for the second dose is the gap. And with Covishield, you can take it anytime from 4 weeks up to 8 weeks. I think they've extended Government of India to 6 to 8 weeks. But studies overseas with this same vaccine have said that it works even after 12 weeks, but certainly not 6 to 8 months. No, please don't go over, I would say at this point, 8 to 10 weeks.
All right, Dr. Gupta, this seems to be a big worry right now, especially because we don't seem to have enough doses of the vaccine. Those people who have, are due for their second dose of the vaccine are getting quite agitated given, the lack of doses.
Yeah, this is something which is certainly real, that, the vaccinations are not currently as free-flowing as they were maybe a couple of months ago. And people, I'm also getting inundated with requests, and I'm sure Dr. Rachna over here is also getting the same, where, people are reaching out and asking, where can I get the second dose? But you know what, if you've gotten at least one dose, there is some immunity in your body. There is something which is going on. And we saw from the data from the trial that one dose gives you upwards of 70% immunity. So, even if you take that, now how long that 70% immunity lasts is a matter of debate. But at least you've got something going on in your body. and we'll take that. And as the vaccinations become more available, it would be time. I foresee a big rush, not just of 18 to 45-year-old, but also people who've gotten one dose and now want the second dose. So that rush is also going to be there because they're all going to be due for the second dose. So I think we have to wait and see when the vaccinations come and become free-flowing. But this is certainly something which is real. But you know what? Like I said, at least one is better than none.
All right, we have a caller from Toronto. Venkat, calling from Toronto. Go ahead with your question.
Hi, very good afternoon. I have my father diagnosed COVID positive. So today is the seventh day of day 7 for since his first symptoms. So his age is 62 and he has comorbid conditions of diabetes and psoriasis, rheumatoid arthritis, a couple of these conditions. So basically, I wanted to know how frequently we should be running the blood inflammatory marker test for him.
Okay, Dr. Kochariya?
Yeah, sure. Again, I would suggest not getting into this loop of running the inflammatory markers. The first most important thing is the patient's clinical condition. How are they feeling? What are their symptoms? Are they short of breath at home? What is the fever? What is the oxygen level? All of this will give you enough indication as to the patient's condition, and we categorize them as mild, moderate, and severe. And really, if the test should only be done with the prescription of a physician, with the suggestion of a physician, who is then willing to follow up on these tests. Many times I get patients having got them done before, or some family person has got them done, or a family physician told them to get them done. And then you're stuck with labs that you didn't order and didn't need, and then there are no answers for that. Labs, these should be done only in conjunction with the patient's clinical condition, and as I said, ordered by the physician. So that's the big caution that I would like people to take away from this. They can cause more harm if you do labs unnecessarily than benefit your patient.
All right. We have a tweet question in from Vignesh. He asks, almost all COVID deaths I'm hearing about in my close circles are due to heart attacks. So how can infected patients watch out for any signs? Are anticoagulants, blood thinners of any preventive type? Should these only be administered to patients with severe symptoms? Dr. Gupta, to you that question.
So that's a great point. So I'm a cardiologist, so this is a question which is right up my alley regarding COVID and heart disease. And COVID definitely does involve the heart in various ways. We are seeing, we are seeing arrhythmias, which is irregular heart rates, in irregular heart rhythm in people with COVID. We are seeing a lot of some cardiomyopathy. Cardiomyopathy is affection of muscles of the heart in patients who've got COVID. This is usually seen in people who've got moderate to severe COVID, and we can diagnose it with an echocardiogram, which is an ultrasound of the heart. What COVID does is it makes your blood thicken. So that is where the thing of blood clots come in, and these blood clots can go in different parts of your body and cause different problems, and I've seen quite a few cases of that. And that is why we give you blood thinners. Now, these blood thinners are not to be taken for everyone. They're not something which you go and pick up over the counter. They're fairly strong medicines, and they have to be dispensed on a case-by-case basis. Now, cardiac arrest is something which basically means your heart goes into a funny rhythm, or your just heart stops beating altogether. And this is not just a manifestation of COVID. It is also seen in if you get really sick with some other diseases, your heart basically goes into a funny, irreversible rhythm, causing a cardiac arrest. And this is not a reflection of COVID on the heart directly, but is an indirect effect of everything else which is going on in the body. All the inflammation, all the electrolyte abnormalities, the low oxygen. So all these things can precipitate cardiac arrest, and that is usually how a lot of people die. And so when does a person die? He dies when his heart stops beating, or usually most people before they die, they have a cardiac arrest of sorts. And this is not just with COVID, it's with most diseases.
All right. We have another tweet question. Can lung fibrosis patients take the vaccine, and any specific precautions to be taken by such high-risk patients apart from the nebulization, oxygen supplement, etc.? Dr. Kochariya?
Well, as far as the contraindications listed for the vaccine, this is not one of them. But lung fibrosis patients are in a severe category. I'm sure these patients would have a pulmonologist involved in their care. So I would suggest that they take the advice of the pulmonologist before getting the vaccination, and which kind, all of that, because, they are on sometimes suppressant drugs and all of that. So this has to be done case by case, and I wouldn't like to give a blanket answer here.
All right, important point there to really consult, the doctor who's doing the treatment. Well, thank you so much, doctors, for taking out time and answering all those questions and all those doubts that people have. Thank you for joining us today.
Thank you for having us.
Well, that's all the time we have on the show today. Thanks so much for watching. Goodbye.